Hello, welcome to the Expert Series. Today we are joined by Professor Grace Szeto. She has been teaching physiotherapy in undergraduate programs for over 20 years. Her research interest is in work-related musculoskeletal disorders, ergonomics, and biomechanics, especially neck and upper limb disorders in computer and smartphone users. Professor Szeto has been a member of the Hong Kong Occupational Safety and Health Council and has been the chairperson of the research committee since 2017. She is currently serving as associate editor for the journal Musculoskeletal Science and Practice and editorial board member for Applied Ergonomics. Fun fact about her, she is a K-drama and BTS fan. We are also joined by our producer Neha Rao. I am your host Aditi Bhatt. Professor Szeto, welcome to the show.
Hi, Aditi. Thanks for inviting me.
Thank you for having us. So I'm going to ask you, and this is something that we ask all of our other speakers as well, is what drew you to the field of ergonomics and occupational health?
Well, it started when I was working as a physiotherapist, treating patients with neck pain, back pain, etc. And I find that from my treatment, I can make their pain goes away. But if they don't improve their work habits, their pain will come back. So I find that it is very, very important to ask the patients the details about what they do and how they do their work. And then, of course, I was finding that a lot of office workers have this neck pain problem from sitting in front of the computer and the computer screen and keyboard on the wrong place. So that drew me into the study of ergonomics, and I just became very interested in that. And I find very great satisfaction when I teach the patients how to improve their setup of their computer screen and keyboard. And it helps them to maintain good posture and then keep them healthy and relieve their pain. So I began when I started to do the postgraduate studies and also started to take up teaching and also research. I got into the field of studying about how people may have developed different muscle imbalance or abnormal posture. So I've been pursuing this kind of research for the last 20 years. Yeah.
As you were talking about correct posture and incorrect posture, I found myself correcting my own posture. Like I don't want her to point out.
That's right. Yeah.
So can you share some insights from your extensive clinical experience in physiotherapy in various countries?
Yes. And then in my last 20 years of teaching and having research and also attending conferences and exchanging ideas with people from different countries, I find that actually different countries have different legislature defining what is an occupational injury or occupational disease. Now, because I've lived in Australia for quite a few years, that was before I came back to teach in Hong Kong. In Australia, if a worker goes to the GP, the medical doctor, and say that I have neck pain and it's related to my work, their insurance cover will already accept that as part of the work-related medical expense, and they would be covered. The medical expenses, including physiotherapy treatment, would be covered under the insurance. But in some countries like Hong Kong, where you have to actually prove the cause of the pain, which is a bit more difficult because a lot of these office workers, they may not have a very specific injury, but it is a cumulative gradual onset of neck and shoulder pain due to their everyday work with the computer. And of course, everyone with the process of aging, there may be a certain element of degeneration. So sometimes we will sit with doctors and we even argue, is it really a pain caused by work, or is it due to the natural process of degeneration and muscle stiffness, etc. So in Hong Kong, the rule is more stringent. So you find our occupational injury statistics is much a lower rate because you need to fill in a lot of forms. It needs to be
Right.
sent to the labor department in Hong Kong, and they have some medical doctors to examine how you develop the pain and whether there was a specific incident before it can be accepted as an employee's compensation claim. So a lot of people don't bother, and then they
Mm.
would just go and use their normal public health entitlement to get the treatment. And
Mm.
so then those kind of differences in the definition of occupational injury disease can lead to different statistical rates of these kind of disorders. And also, there is also a cultural difference. For example, in a lot of the Asian countries, we tend to have, I don't know, maybe I say, a higher tolerance of pain. Because often we said, oh, aches and pains is the normal event in life.
Right.
And
Yeah.
we have a very strong work ethics, I think.
Mm.
A lot of people are afraid of losing their jobs if they say, oh, my work is causing the pain. Whereas in a lot of the Western countries, their legislature is that related to occupational safety is more developed, and they have stronger unions, etc. So
Mm.
people are very more open to talk about their pain, and that they would be more willing, more forward-coming to seek help. Whereas in a lot of the Asian countries, actually it's more the last maybe 10, 20 years that we've become more accepting of that we have pain and we are entitled to receive treatment. But in the old days, you know that a lot of people may just suffer with that, put up with their pain and just carry on with their work and just accept it as part of their life. So that is some difference in the different countries due
Yeah.
to the culture and also the legislature in the different countries.
Right. So you bring up an excellent point. I remember my parents, they would not take a leave because having pain would mean taking a leave, and that would often mean you don't get paid for the days you take off. So,
Yeah,
in order to ensure that there's food on the table, it's like, okay, pain is a part of our life. Let's just get through
yeah.
this.
When I even when I was doing research in Hong Kong, if a company invite me to go and assess their workers' computer workstation,
Hmm.
uh, a lot of people don't feel comfortable to let me take photos of them working in
Ah.
at their
Hmm.
computers. Whereas in the Western countries, I see in like Sweden, in the European countries,
Yeah.
their workers would allow the researchers to put on sensors all over their body, electrodes, and follow them for the whole day to do all the measurement.
Hmm.
And they are very willing to participate in this kind of research projects. Whereas in Hong Kong, they will be very skeptical. They say, why are you measuring my muscles, and what's the outcome? Would my boss, be discover that I'm not doing my work
Hmm.
correctly, or they are very sensitive about this sort of thing. So
Yeah.
it's not so easy to do research in the workplace in probably in the Asian countries. I expect the same with India as well. Yeah.
Yeah, absolutely. I hear you on that. And it's timely. And also, your virtual symposium focuses on the impact of WRMSDs on employees,
Yes. Yes.
particularly the neck and shoulder regions. So, can
Mm.
you talk a little bit about your symposium?
Yeah. I'm very happy to have this opportunity to organize the virtual symposium. I invited some very good researchers. Beside myself, there are three
Right.
other international researchers. Dr. Tessie Luger is from Germany.
Mhm.
Professor Pascal Madeleine is from Denmark. And Professor Alberto Heredio Rizzo is from Spain. And the four of us have all have strong interest in researching on the mechanisms behind why people get pain in the workplace, and also how to introduce some interventions to help them relieve their problems. So the first speaker will be Dr. Tessie Luger. She is the head of the work physiology lab at the Eberhard Karls University and University Hospital of Tübingen, Germany. She's been doing research on these the biomechanics and the work-related musculoskeletal disorders for many years, and she has been looking at the different kinds of breaks, active breaks versus passive breaks in the work for those who have a long duration of work. This time she will discuss the results of a research study she has done on laparoscopic surgeons. So looking at, how surgeons, they can do the surgery work for, it can sometimes take hours. You can imagine when a surgeon is doing the surgery. Actually, we call this the chicken wing posture. When the surgeons have to hold their arms up and they have to do this fine manipulation of the surgical instruments on the patient, right? And so a lot of surgeons also have neck and shoulder pain. So she's looking at the effect of active breaks, meaning that the surgeon may actually take a break and maybe do some exercises. We also have different countries have introduced this program in to office workers. Whereas passive break, meaning that you just take a rest and just relax and don't do anything. Okay, so that would be called a passive break. So is it better to do exercises while you're having a break, a rest break, or is it better to just rest? Okay, so I think that is a very interesting question. And she picked a very interesting group, the laparoscopic surgeons. So she's going to talk about the results of that study in her presentation. The second presenter is Professor Pascal Madeleine. I've known Pascal for many years. We have very similar interests in research. And he's actually French, but he lives in Denmark. And he's from the Aalborg University. They have a very strong team in looking at the biomechanics and research on pain in different body regions. And recently, he's been doing research on the different modes of biofeedback, looking at either using single bipolar, one-channel bipolar surface EMG to do the biofeedback, or multiple channels on different muscles in the neck shoulder region. As you know, our neck and shoulder, we have trapezius, we have erector spinae, we have many muscles that control the neck and shoulder posture. So he's looking at the effects of these different modes of applying biofeedback to produce muscle relaxation or to reorganize the activation of muscles in the neck shoulder region. What are the effects of these different kinds of intervention? And also another type of biofeedback he has done is called mechanomyography. It's using kind of not just a signal, but a vibration in the sensor when the EMG signal pick up the muscle activity. So it is quite advanced technique in using biofeedback. So he's been doing this kind of research for many years and is a very well established world-class researcher. So I learned from him a lot too. So he will be presenting his work as the second speaker. I will be the third speaker, and I will present a recent study that actually I'm still doing right now, is that I find recently there are products available on the market that are coming from research. Okay, it is really good to see this. Now you can buy actually a wearable sensor that is like the size of a small, something like this size, okay? A small sensor, like a small matchbox, okay? And you can apply it on the back of your neck or your upper back or lower back. And you can actually, you can activate the app on your phone from Play Store or iPhone. And then you can once you activate the sensor, it will sense your head or your spinal flexion angle. And you can set how low to activate the feedback signal. And then it will give you a vibration when your your flexion angle is exceeding the threshold. So, and it is very economical. So I think it is a great idea to see how people can use this such a easily adaptable sensor in your daily life, compared to a more clinical sensor, which will sense the muscle activity. We call the muscle biofeedback sensor, which apply on the neck muscle to sense if your muscle activity exceed a certain threshold. It will give you a auditory signal, not a vibration signal. So I have a study ongoing right now that examine the effects of 6 weeks using these two types of sensors on different people for 2 hours daily, and see what is the effect, which one is more effective to produce a reduction in neck pain, and also to remind people to become more aware. You know how everyone nowadays is always looking down at their smartphone,
I was
their
just gonna
tablets,
say that every
computers,
time
so
I use my
everything.
smartphone, I think my neck is permanently going to look like this.
Yeah, that's right. So we there's actually a phenomenon called the head down tribe, the head down generation, in Chinese, 低頭族, meaning that you're always looking down, okay? 24 hours a day when you're not sleeping, you're looking down. Okay, so this is the area that I'm most interested in. So I will present my research on that. And the fourth speaker is Professor Alberto Heredio Rizzo. He's also a physiotherapist from Spain. He has been looking at the effects of different kinds of exercise intervention among the office workers, which include like aerobic exercise or strength training exercise, like resisted exercise, and functional training. So what is the effect of doing these different kinds of exercise training? How can you make people compliant or adhere to the exercise program? That is very important. So he was looking at the effects of maybe using some digitally delivered intervention. For example, maybe have some reminders or some apps on your phone to remind you to do exercise. What is the outcome of such intervention? So he will present the results of that. So I think the four topics are very closely related and very applicable to clinicians, researchers, as well as people who are actually, we ourselves are also victims of this kind of problems. You know, I tell people to not always bend their head down, but I do it all the time myself too. So, so I hope we're not doctors who cannot cure themselves. We have to sit up straight first.
Oh, that's a wonderful team that is gathering for this symposium, and I really look forward to it. Are there any? I know you mentioned that workers and surgeons, but are there any other particular groups that the four of you are focusing on, or are those the two groups?
Now, the first speaker, Tessie, is talking about the surgeons, right? The rest, the three of us have been doing a lot of research on office workers, which can also include people like teachers or university students or educators or people who do use computers or electronic device a lot, which really covers, you know, a large proportion of the general population nowadays. As you people in the urban environment, people living in the cities and not so much those in the farmers, that may be the one exceptional group. Also the construction workers, that will be another category. They do more heavy work. We're looking at more people who maintain a lot of static posture and seated posture most of the time. That is our sort of target in the in our research topics. Yeah.
Got it. So I'm not obviously not going to ask you to share the findings of your research so far. I know you're still doing it, in the process of it, I mean. But can you share common risk factors and preventative measures for workers who use computers and mobile devices extensively? So basically everybody.
Yeah. Now, there have already been a lot of ergonomic guidelines available. And nowadays, you just, even on the Google or internet, you can find a lot of recommendations about how to position your screen and also to position your keyboard and the mouse in a
Right.
good position. Those kind of suggestions are all readily available. But it's important that a lot of people don't realize their own posture. They would focus on their work so hard that they would forget that their neck is going more and more forward, their muscles are tense up, and that they've been sitting for hours. Sometimes we don't have this awareness, so we often advocate people should take a break every. If the break can be even for 3 to 5 minutes every hour. Because a lot of people, even you mentioned different what kind of occupations, people who are even engineers or draftsmen, they designers, they may sit in front of the screen, or people who develop IT technology, they sit for 3-4 hours, they don't realize they haven't been getting up at all. They don't. So even taking a toilet break is good. So that's why nowadays, last few years, you find that people who sell furniture now are advocating the standing desk, or you can actually buy a gadget to put on top of your desk so that you can stand up once in a while rather than sit all the time. That is the latest recommendation. But of course, if you have to stand 8 to 10 hours a day, it's a bit too much. So there's been research advocating that you sit for 2 or in like a morning session, you spend maybe 2 hours standing, 2 hours sitting, or to alternate 1 hour standing, 1 hour sitting, something like that. That will help to relieve the pressure on your back, on your spine, and also your muscles don't have to keep like the rubber band always keep on tension, because they have to maintain the posture in a static position for a long time. So those are the recommendation. Also, overall, people nowadays they don't play sport. They play sport on the on the phone. They don't actually go really to not really go out and play sport. Okay, so we a lot of times we need to for the health, a sedentary lifestyle, too much sitting is not good for health. So not just the musculoskeletal system, but also cardiorespiratory, your cardiovascular fitness. Okay, so and also may lead to obesity and diabetes, even heart disease. All these things can result from too much sitting and not enough exercise. So all people need to be aware. We are always advocating this kind of important change in the lifestyle, to be aware of the adverse health effects of sedentary lifestyle. Yeah.
Interesting. So active pauses, biofeedback, postural correction, exercise training, these are all very
Yes.
important interventions for managing
Yes. Yes.
musculoskeletal
That's right. Yeah.
disorders, right? Can you explain how these interventions work and their respective roles in addressing different aspects of the disorder?
Right. Actually, the different kinds of interventions, like the active breaks, doing exercises, and or using biofeedback. Of course, actually, using biofeedback involves you really need a very lot of compliance from the people. It would be more those with more severe pain. They
Right.
try doing exercises, they try improving their posture. It still cannot work. Then we would recommend them to use their biofeedback device, because it's more hassle. You have to put the sensor on, and you may have to buy the device and things like that. So the most simple is knowing to have an awareness of your posture. Taking active breaks doesn't cost anything, right? And also now doing exercises in the workplace. Some people are happy to do that. Some people think that it is a bit strange. All right. So sometimes we just say, recommend people to maybe when you take a break, go for a walk. And maybe walk. Nowadays we have the printer is next to you, or even you don't print anything, right? You read everything on the screen. So your eyes are also tired, your muscles are tired. So taking a break is good, that you can relax your muscle, even let your eyes have a rest. So those would be the easiest interventions. And also look at your total work hours. And also after work, go and do exercise, or if you don't do it in the workplace. Now, again, in a lot of the developed countries, Western countries, they would actually may have a gym room in the company, or they may have some nice, maybe have some bicycles, stationary bikes for people to do work, to do exercise in between work hours. And some companies will even organize social activities for their staff. That, of course, is the fantastic thing. But if you don't have that kind of setup, then you have to be more disciplined and make yourself exercise, either maybe during your lunch hour, go out for a walk. After work, we often advocate a lot of stretching exercise. And sometimes even in Hong Kong, some of the hospitals, or the construction work site, and even schools. As I'm a member of the Occupational Safety and Health Council, we do advocate this sort of things. And some companies would make all the staff do 10 minutes of exercises at the start of a work day, and then or in the middle of the workday and at the end of the workday. And those are good work habits that if it can be introduced at the workplace, is a good thing. Yeah.
Have you personally found something that works better than other interventions for you or for your students or for your friends, family? What is the one thing that you would tell them to start doing?
Actually, many people about the forward head posture, a lot of people don't realize it. And sometimes it's taking a photo. Someone else take a photo either from the side or from the back, and then show them. And then also, we often do a lot of education. We show them the structure in the spine. And then we show them the bones, the head. There's a picture we use a lot about with the skeleton, showing the head. And the head, the weight of the head is actually held up by your spine. So if we show them that horrible picture of the head going forward, and also taking a photo, nowadays so easy with the cell phone, and then show them, then they realize, gee, I didn't know that my head was, and my spine is so curved. Showing them their own posture and then reminding them is a very useful thing.
Building awareness, that's a great first step.
Yeah.
Thank you for that. We're coming to an end of our episode, but I have one last question for you.
Yes.
As a physiotherapist, as an educator in the field, what advice do you have for students who are interested in this field?
Yeah, actually, in teaching physiotherapy, because we work with people at all ages, and also we have a lot of different specialty areas like neurological, cardiorespiratory things. So I always try to stimulate or inspire my students to have this strong interest in occupational health and ergonomics. So I sometimes I will show them the kind of interesting jobs that I have done. For example, I have gone into people's office to assess their posture, etc.
Right.
And the most dangerous one I have done is actually one. One time I was invited by a company. The container pot. They have a lot of those high cranes.
Yes.
Right? And the operator needs to go to the top of the crane, and there is a control room on top, and they have to control the hook that will grab the container and put it on the ship, right? The container pot.
Yeah. I've seen it happen, like maybe in a movie or I'm watching a documentary and something like that. But yes, it looks quite dangerous climbing.
And, once they go up there, they work there for many hours before they come down. So they also suffer a lot from back and neck pain. So it's not just people who sit in office, typing on computer. So I was invited by the company to take all my measurement instruments, my surface EMG and all the sensors, and I work with my assistant. We climb up to the crane operator control room, which is like 10-story high up, and put sensors on them and measure their spinal movement and muscle activity. So, as a physiotherapist, I never think of doing something like that. So that was a very interesting kind of work that I did. And so quite interesting experience. So I will show that experience to my students to inspire them. You never know what kind of workers that you work with. For example, we now have some students that graduated and work in the Disneyland as physiotherapists.
I love that for them.
Because they have to, because Disneyland, the dancers,
Mickey
they
Mouse himself.
they also have a lot of aches and pains. So they actually hire full-time physiotherapists to give them treatment and also to educate them how to do their stretching or prepare for their dancing work. So there's a very diversified area that we can work in. So and also we get a lot of satisfaction to help people improve their quality of life and regain their functions, for example, after they've had injury. So that's the kind of things I try to inspire my students to do.
That's very inspiring. I'm sure that works. And now I can't get the image of a physiotherapist like doing his w- treatment protocol on Donald Duck or Cinderella. I just can't get it out of my head. Donald Duck's just sitting there going, "Oh, my neck, my shoulder."
Yeah, that's right. So yeah, we don't just work in hospitals. We go to different companies. We can go to different site construction sites. I've also done some work with rebar workers. They tie the steel rods on the construction site. They also have aches and pains. So all kinds of occupations and all kinds of situations, they can benefit from advice from physiotherapists. So yeah, that's the beauty of our work.
You're doing wonderful work, Professor Zato.
Yeah, thank you.
Thank you for joining us. It was a
Yes.
pleasure talking to you, and I look forward to hearing your symposium.
Okay. Yeah. Thank you. Thank you for this interview. Yes.
And let's do another one on BTS.
Oh, you have to give me time to practice my dance moves.
Me too. We'll do a choreograph together.
Okay. All right.
All right. See you then. Bye.
Okay. All right. Bye bye.